Today I will be doing an ultrasound demo of scanning the liver. I will begin by selecting a 6 megahertz curvilinear transducer, and with the abdominal preset, I will begin with the patient in supine and begin by doing a sweep of the entire liver. Patient, take a deep breath in and hold. We'll want to do an entire sweep to make sure that we find the best window for scanning the patient. Breathe. Breath in. Alright, so it looks like midline on this patient works best. So I'll begin in the sagittal plane, midline liver, where we see the caudate lobe, and I'll sweep through the left lobe of the liver, making sure to completely sweep out of the liver. Deep breath in. Breathe. Today I'm scanning on the GE. Hitting auto optimize will help enhance my image. Deep breath in. Breathe if you need to. And all the way out. Okay, breathe. I will do the same thing for the right lobe in sagittal. Deep breath in. Starting at, again, where we see the caudate lobe. IVC, breathe. And here I'll want to drop my frequency, deep breath in, to get rid of some of that shadowing that we get from the portal system. Breathe. We want to make sure to sweep up to the dome of the liver and out. Deep breath in. Okay, breathe. As we're sweeping through the liver, we want to look at the contour of the liver, the echogenicity, vascularity, and note any abnormalities we see. The next thing I want to focus on is getting a liver kidney picture. Deep breath in. And we do this to compare the echogenicity between the liver and the renal cortex. This is useful in diagnosing things like fatty infiltration, for example. Moving to the mid-clavicular line, deep breath in. I will want to measure the liver, and we measure from the diaphragm to the lower edge of the liver. Now we'll be looking at the liver in transverse. Starting with the left lobe, and we'll do a sweep superior to inferior. Deep breath in. Here we see the portal system, ligamentum teres, and catching some of the pancreas. Breathe. Okay. We will do the same thing for the right. Deep breath in. Increase. Moving superior to inferior. Dropping laterally as we move through the sweep, where we see the kidney, right kidney, and gallbladder. Breathe. Now to assess vascularity, we'll look at the main portal vein. This is best viewed from the intercostal approach. Breath in and hold. We'll want to make sure that the flow is hepatopedal. Breathe. Deep breath in. Hold. Doppler it to make sure that we are above the baseline and the flow is continuous. Finally, I will look at the CBD, common bile duct, which we see running with the portal system and the hepatic artery. Deep breath in. We'll want to throw on color to make sure that we're not looking at the hepatic artery, but we are truly looking at the CBD. Right there. You can also zoom in. And we'll want to take off color when we're doing the measurement to make sure that we're getting a more accurate measurement. Some things to remember, and especially difficult patients will want to, some things we could try is scanning the liver through an intercostal approach, or rolling the patient to the left lateral decubitus. And that sums up my ultrasound demo of the liver.